This is King B News and Views with yet another video. This is my third video of the day. Shout out to each and every one of you. Okay, so you see the title on the screen. Diabetes / weight loss med linked to repeat spinal surgery. This article released just five days ago by the Amazing Times. And let's get into this, and let me dig into this article here. Chicago, the diabetes / weight loss drug semaglutide is associated with a significantly greater risk for repeat operations in patients with diabetes who require lumbar surgery, a new study suggests. Now, why does this sound familiar, this drug, semaglutide? Because in my first video of the day, right, people being intentionally poisoned, that article in the first video I've released today mentions this drug, semaglutide. Right? Let's continue. The risk for additional surgeries was even higher among patients taking the popular weight loss and diabetes drug for longer periods of time. Investigators say the study provides the first evidence on the impact of semaglutide on spine surgery. The expectation was that we would see patients doing better after surgery, less wound complications, and other things. And in our diabetic patients, we did not see that and saw increased odds of needing additional surgeries. Investigator Syed the first, Khalid MD, neurosurgery resident at University of Illinois Chicago, told Medscape Medical News. The findings were presented on May 3rd at the American Association of Neurological Surgeons 2024 annual meeting. Additional surgery at year 1. The new study used the all-payer Mariner database to identify patients aged 18 to 74 years with type 2 diabetes who underwent elective 1 to 3 level transformational lumbar interbody fusions between January 2018 and October 2022. Patients were matched in a 3-to-1 ratio for age, sex, hypertension, obesity, smoking history, chronic kidney disease, osteoporosis, insulin use, and spinal fusion level, resulting in 447 patients with semaglutide use and 1,334 with no semaglutide use. More than half, or 56%, were female. 62% used insulin and 81% underwent single-level TLIF. Total medical complications were higher in the semaglutide group at 13.4% compared with 7.7% in the no semaglutide group, odds ratio 1.85. This was driven by higher rates of urinary tract infections, 6.7% versus 2.5%, and acute kidney injury, 6.3% versus 3.9%. 2 complications observed with semaglutide in other studies, Khalid said. Total surgical complications, however, were lower in patients taking semaglutide at 3.8% versus 5.2% in those who did not, or 0.73. Patients taking semaglutide versus those who were not using semaglutide had fewer wound healing complications, 5 versus 31. Hematoma, 1 versus 9. Surgical site infections, 12 versus 44. And cerebrospinal fluid leaks, 2 versus 3. Still, people taking semaglutide were nearly 12 times more likely to have an additional lumbar surgery at 1 year than did those who did not use the drug, 27.3% versus 3.1%, or 11.79 or 95%, 8.17, 17.33. Kaplan-Mayo plots revealed a striking divergence of these populations when semaglutide exposure for more than or less than 9 months was examined. Currently under review for publication, this study provides the first evidence on the impact of semaglutide on spine surgery, Khalid said. A second follow-up paper, also under review, looked only at patients morbidly obesity without diabetes who had taken semaglutide for weight loss. In non-diabetic morbidly obese patients undergoing spine surgery, we see a similar trend, Khalid said. Sarcopenia, the cause? The additional surgeries were primarily extensions of constructs, with additional surgery and fusion at more levels, Khalid noted. The idea is that it could be the fact there is sarcopenia or muscle loss that's taking place in conjunction with fat loss that's causing that to happen, Khalid said. The mechanism remains speculative, but evidence from other areas examining frailty states has shown that those patients have weaker bones, sarcopenia, and worse outcomes with spine surgery, he noted. The investigators plan to use artificial intelligence to evaluate changes in body composition after semaglutide use in patients who underwent imaging prior to spine surgery or even before back pain occurred, because these medications are uptitrated, over time. Follow-up studies will also look at whether this change takes place with a certain dose, Khalid added. On the basis of the current analysis of generic semaglutide alone, it is not possible to say whether the use of other glucagon-like peptide 1 receptor agonists will result in similar findings, but the odds of a class effect are high, Khalid said. Commenting on the findings for Medscape Medical News, Walavan Sivakumar, MD, Director of Neurosurgery at Pacific Neuroscience Institute, Los Angeles, noted that the timing of surgery is already an issue for patients taking semaglutide and other GLP-1 receptor agonists following recent guidance from American Society of Anesthesiologists that suggests stopping GLP-1 receptor agonists prior to elective surgery to reduce the risk for complications associated with anesthesia. It's an incredibly topical point and seems to be something showing up on a daily basis for clinicians all throughout neurosurgery, Sivakumar said. It's thought-provoking and a great first start. Sivakumar also observed that frailty is a hot topic in all of neurosurgery. That's a major point that's showing an impact on all surgical outcomes and is being heavily studied in the neurosurgical subsets right now. So that's definitely a possible correlating factor. Khalid reported no financial relationships. Sivakumar reported serving as a consultant for Stryker. Well, that's the end of that article, and that's an interesting article because I just did like I said, my first video of the day mentions this drug that's being used that's used for diabetes and slash weight loss, right? And again, all three videos, this video and my first two videos of the day is just talking about how we're being poisoned due to the different medications we take and our foods. Especially with the foods, the toxins, the toxic chemicals in our foods that we eat, right? What it's doing to us, our bodies, our overall health, okay? And again, it's just, as I've said before in the previous two videos, it's just a money scheme. They allow all these toxic chemicals in the foods. Then we go to the doctor and they push other medications and that have these horrible side effects. You know the commercials. You've seen the commercials. You're watching television or televised vision. You watch the commercials. They promoting some or pushing some new drug for something, And then at the end, the person start talking real fast about all of the side effects that it can cause, right? It's just the foods we eat have us filed and packed in the doctor's offices like sardines in a can. They push these medications on us. The medications are no good, causes more problems. It's like just slowly killing us. We're taking poisons among poisons. We're eating poisons. We're taking more poisons disguised as medications. And you wonder why many of us are in the condition we're in. Right? You got a drug here, this semaglutide, or what is it called? Where is it? Semaglutide, I said it right the first time. Being used for diabetes and weight loss. How can it be both? Who thinks it's a good idea to take a drug that's supposedly good for diabetics and losing weight? How can it be both? You think it's not going to be all type of side effects associated with this drug? You think it's healthy? It's really going to help you? Right? How many patients have something wrong health-wise who need surgery, and you got a doctor telling them, okay, well, in order for the surgery, you need to lose weight, and they and went on to advise this patient to, well, take this drug. It'll help you lose weight. You need to lose however many pounds in order to have the surgery you need. They're following doctor's orders, so they start taking this medication. Just to wind up needing a second surgery. This is disgusting what they're doing to us. It really, really is. But with the toxic chemicals in the foods, when you're eating foods that are not healthy for you, you're poisoning your body. You are unable to think properly. You're not in your right state of mind, right? The fluoride that's in our water, tap water, okay? Just look up fluoride, right? Where the fluoride comes from. Fluoride is another toxic chemical, right? It was a toxic waste from factories used by the Germans. They discovered that by putting fluoride in the water, it has an effect on people where it kind of causes you not to be able to think, kind of dumb you down a little, right? Look it up. Do the research. Remember those of us who remember those toothpaste commercials back in the days, promoting toothpaste with fluoride in it. They still sell toothpaste with fluoride in it. Although now we have an option to buy toothpaste with no fluoride in it. It's more expensive, because of course they, you notice they charge more money for something that's healthy for you. For example, if anybody, we all been in the store shopping, grocery shopping, you notice you're going to spend more money in the fruits and vegetables section, especially if you're buying organic fruits and vegetables. You're going to spend more money there with a cart full of fruits and vegetables than buying all them packaged foods with all these chemicals in it. You spend less money buying the garbage on the shelves than you do than what you're gonna spend in the fruits and vegetable aisle, especially if you're looking at you're buying organic fruits and vegetables, right? And even then, how good is the organic fruits and vegetables are when you take into account the chemicals that's being sprayed in the air and getting in the soil and so on and so forth. Okay, but this is what we're dealing with. This is what we're all dealing with. You wonder why so many people have these health problems and health issues. And they tell you, oh, it's hereditary. But is it really hereditary? Again, the only thing that we inherit is our bad eating habits. The the chemicals, the toxic chemicals they put in the foods that they allow in the foods that they don't even a lot of the chemicals, these toxic chemicals, they're not even required to list them. The FDA they don't require the manufacturers to list these toxic chemicals. Check out my second video of the day, my last video. Titanium dioxide. The FDA does not require these food makers or these manufacturers to even list titanium dioxide on the package. They're not required. They don't have to. Right? So they can lie on and say and just put artificial coloring, because the FDA says that titanium dioxide, which is an ingredient in sunscreen, okay, they list it as an artificial food coloring. So these manufacturers get to lie and just put on in the ingredient artificial coloring. But that artificial coloring is really titanium dioxide, an ingredient found in sunscreen, and it's in a lot of the candies that you buying for your children, the Skittles and everything else, the candies that your children love to eat. Many of you love to eat frozen pizzas, frozen foods, other type of foods. Titanium dioxide is not the only poison they're putting in the foods. Again, I said it in that video, second video, my last video, before this one. Because you can do this now. Order a package of different foods, different candies, whatever, online from a different country. Have it shipped to you. When you get it, go to the store out here and get the same type of candies. Place them side by side, look at the ingredients and see what you find when you read the ingredients. Because most other countries don't allow all these toxic chemicals in their foods and their snacks. Only here. Only here we're being poisoned like this through the food. It's chemical warfare. So again, they have us looking outside of this country for the boogeyman. They're coming to get us. Meanwhile, they getting us right here. They've been getting us, waging war on us through our food, through the water, poisoning us slowly, keeping us distracted, lying to our children in school, feeding our children garbage in the schools, lying about real history, police shooting, beating, and murdering our people, and so on and so forth. Right? We've been at war. We've been attacked. We've been occupied. Because again, United States the United States government is a foreign entity. You don't believe me? Do the research, look it up. United States government, United States of America, and America are not the same. The United States government is foreign. They don't operate in law. They operate in statutes and codes. They don't operate in law, real law. We've been occupied by a foreign entity, right? Ever since the Great Depression. Do the research. Look it up for yourselves. So we don't really have to look at some other country coming to get us. We've already been got long time ago. When are we going to wake up to this? Some of us are. But we really do need to wake up. And again, with these 3 videos, with the information in these 3 videos that I put out today, the evidence suggests that the reason why so many of us haven't woken up yet is because all the chemicals in the water, in the foods, the medications, the doctors pushing on us, the pill pushers, chemicals in the water, nanoparticles in the plastic bottles. Check out my previous videos on the water. If you're not subscribed, it'll be a good idea to, if you want to know more of what's going on today, what we face, you may want to subscribe to this channel. Click the notification bell to all. And then while you're at it, go into your profile and go into your settings and make sure your notifications turned on there too as well, because YouTube, when they did their last update, they turned it off. So if you haven't been getting your notifications for the channels you are subscribed to, that's the reason why. So check that out in your settings. Make sure it's turned on there, so you will get your notifications. Leave a comment and share the video. This is important information we all need to know. So you may want to subscribe to this channel, and when you have the moment, when you have a time, check out my previous video. There's a ton of information, important information that I've put out that we need to know. We all need to know, that you can discuss when you're talking with your loved ones, right? Love yourself unconditionally. Keep your loved ones close. Talk about these issues. Have multiple plans, and go over your plans so you are prepared for whatever you may need to deal with and face, whatever circumstances. Protect our children and our babies. Let's get back to agriculture and growing our own foods. We need to prepare ourselves. We need to become self-sufficient and not relying on this wicked system, this government, right? Govern means to control, mind control. Government is mind control. We don't need to be controlled. We can think for ourselves, and we can take care of ourselves and do for selves. We need to come together and take control and be in control again. That's what needs to happen. Protect our children, protect our babies, protect our women. Shout out to all the natural born women out there. This is King B News and Views. Thank you for tuning in. I'll see you in the next video. Peace.